Hi, my name is Julie Pekarsky. I am a nurse consultant. In today's session, we will discuss the care of the patient with a urinary catheter. A urinary catheter is a tube that is inserted through the urethra and into the bladder to drain urine. The urinary catheter is inserted temporarily into the bladder to relieve the pressure from a full bladder of urine. The full bladder may be caused by a medical condition that does not allow the urine to flow out freely from the bladder. The inability to empty the bladder is called urine retention. For obtaining a sterile urine specimen, a straight catheter may be used. To cleanse or wash out the bladder by instilling sterile solutions and medications through the catheter tubing, this cleansing procedure is known as an irrigation, and a temporary catheter may be used. Sometimes the catheter may be used to drain the urine continuously. This means that the catheter will remain in the bladder and drain the urine through tubing and into a drainage bag. Times that this will happen will be when a person suffers from urinary retention that cannot be surgically corrected, when skin breakdown is caused or irritated by the urinary incontinence, when a terminal illness or severe impairment makes a bed and clothing changes uncomfortable or disruptive for the patient. For example, if a person has cancer, frequent repositioning when they're incontinent could be painful and uncomfortable for them. Therefore, they might have a catheter to drain their urine to decrease their incontinent episodes, and they would be more comfortable. Also, when a medical condition requires accurate measurement of all urine output, a continuous urinary catheter may be used. And then when a patient suffers from nerve damage caused by injury or a disease such as stroke, continuous urinary drainage may be used. Before we go on, I'd like to discuss the functions of the urinary system and the structures. There are two kidneys. They are organs that filter impurities from the blood. Ureters are two tubes that carry urine from the kidneys to the bladder. The bladder is a container that stores urine until the urge to void. The urethra is a tube that carries urine from the bladder to the outside of the body. I'd like to discuss the equipment that is used for the urinary catheter patient. We have different types of catheters. This is a straight catheter, and this is the one that is used to insert temporarily into the bladder. And it is used to obtain a urine specimen or to just empty the bladder of urine. When the patient has to have continuous urinary drainage, they will have a Foley catheter. Sometimes it's called an indwelling catheter or a retention catheter. And this is what the catheter looks like, and it will remain in the bladder. The catheter has a balloon at the tip, and this balloon will be inflated with sterile water, and you can see that it is being inflated right now with the sterile water, and this prevents the catheter from slipping out of the bladder. And as you look at the diagram, you will see how the placement of this catheter is in the bladder. The other urinary drainage equipment that you need to be acquainted with is for continuous urinary drainage is, here's the catheter we discussed, and it is connected to tubing and a drainage bag. This tubing is clear, so you can observe and report any characteristics of the urine. This will hang on the bed frame, and it has a little spout here that can be used to drain the urine. In order to prevent pulling of the tubing, a leg strap will be applied to the thigh. And this leg strap is applied to the catheter, is connected to the catheter after it's applied to the thigh, and that will prevent it from pulling out. In order to provide dignity and privacy for the resident, we will also use a catheter cover bag, and this bag will cover the drainage bag. It will be applied when the resident is at the bedside or in their wheelchair, or when they're walking, perhaps with the walker. Sometimes they will be applied to the walker. Let us now go over the principles of catheter care. Providing emotional support is very important for people who have urinary catheters. The patient may be embarrassed to have a tube draining their urine in the view of others. To help the patient maintain dignity, the drainage bag has a cloth cover placed over it. Emotionally, the patient may be upset that he or she has lost control of their bladder function. The patient may be fearful that he or she may never regain control of their bladder function. As a caregiver, you must be professional and use a matter-of-fact approach when caring for these patients and be sensitive to their needs. Also, you must provide an aseptic environment, and it must be maintained to prevent bacterial growth and development of infections. The system must be kept closed and sterile at all times. Poor aseptic technique can cause a urinary tract infection. Catheter equipment must at all times be handled with concern for patient safety and comfort. A licensed nurse or a technician trained specially to insert a catheter will use sterile technique. As a caregiver, you are responsible for maintaining the sterile drainage system and keeping the system closed. The responsibility of the caregiver when giving a patient care, they must wash their hands before and after handling catheter equipment. They must apply gloves before handling a catheter, making sure that all connections are tight to prevent leakage from the catheter and prevent germs from entering the drainage system. Remember never to disconnect the urinary tubing from the catheter without permission from the nurse. Catheter leg straps should be used to prevent pulling on the bladder. Note that the catheter leg strap may not be used if the patient has a circulation problem, and also if their skin has irritation from the leg strap, it would not be used. Make sure the tubing is free from kinks and that the urine is flowing freely by coiling excess tubing and attaching the tubing to the bed linen with a plastic clip. Make sure the drainage bag is below the level of the catheter and the bladder. The drainage bag must be attached to the frame of the bed and not the side rail. The drainage bag should never rest on or touch the floor. Privacy and dignity is maintained at all times by covering the drainage bag with the cloth cover. Empty the patient's drainage bag before ambulating or transferring the patient. Move and transfer the patient carefully so as not to dislodge the catheter by pulling on the tubing. If the patient sits in a wheelchair, the drainage bag must be attached under the seat of the wheelchair. The caregiver is responsible for observing the characteristics of the urine and the condition of the catheter and drainage equipment. You must report the following to your nurse. Report to the nurse if there is any leakage around the catheter. This can be a sign of obstruction, bladder spasms, or urinary tract infection. The resident may report to the nurse that they feel that they have an urge to urinate and they still have a catheter in them. Please report this to the nurse. Report any pain, burning, or sensations and any other discomforts that the patient would report to you. Maintain careful output records. Notify the nurse immediately if there is a decrease in urine output that is abnormal for this patient. Notify the nurse immediately if the urine appears to be dark, foul-smelling, or have sediment in the catheter tubing. Now please watch the demonstrations for the care of the patient with a urinary catheter.
Urinary catheter care. Begin by washing your hands. Gather needed supplies. Provide for privacy. Put on your gloves and elevate the bed to a comfortable working height. Cover the patient with a bath blanket while fan folding the top linens to the foot of the bed. Place the towel or bed protector under the buttocks. Position the patient on the back with legs separated and knees flexed. For the male patient, place soap and water on the washcloth. Hold the penis gently with one hand and washcloth with the other. Clean around the catheter at the tip of the penis first, turning the washcloth after each stroke. Retract the foreskin if uncircumcised and wash the area thoroughly. Don't forget to return the foreskin to proper position. Wash, rinse the catheter from the urethral opening down about 4 inches. Then you wash the shaft of the penis, followed by the scrotum. And then rinse. And then finally drying. For the female patient, place soap and water on a washcloth and separate the labia or the lips with one hand and use the other hand to control the washcloth. Wash and rinse the urethral opening, followed by washing and rinsing about 4 inches of the catheter. Cleanse one side of the labia, then the other, then the center, working from the front to the back and turning the washcloth after each stroke. Dry the entire area thoroughly. After providing catheter care, secure the catheter to the leg strap if it's being used. Check to be sure that the tubing is coiled on the bed and secured. Observe regarding any pain, pressure, or skin irritation or any other changes you might notice. Replace the bedding after removing the bath blanket and underpad. Dispose of supplies. Remove your gloves and wash your hands. When you return, lower the bed to its lowest position and adjust the side rails for safety if needed. Finally, wash your hands. Emptying the urinary drainage bag. Wash your hands and put on your gloves. Gather your needed supplies and explain the procedure to the patient. Remember to provide for privacy. Place the graduate on the paper towel under the drain spout. Do not kneel on the floor when doing this procedure. Remove the drainage bag from the bag cover. Remove the drain spout, being careful not to touch the tip of the spout itself, as germs can enter. Drain the urine into the graduate without letting the spout touch the sides of the graduate or anything else. Close the spout and wipe with an antiseptic wipe. Replace the spout in the holder on the bag. Replace the drainage bag back into the bag cover. Pick up the graduate and paper towel and dispose of the paper towel. Measure the urinary output at eye level on a flat surface. Observe for color and consistency and make a mental note of your findings. Discard of the urine in the toilet. Remove your gloves and wash your hands. Remove the privacy screen and lower the bed to its lowest position. Record the output and other findings on your notepad. Transfer the information to the intake and output record and record any unusual findings to the nurse.
There are patients who have a catheter for continuous drainage that are ambulatory, and they would find it very cumbersome to carry the tubing and the drainage bag. These patients will have what they call a leg bag drainage system. And this is a leg bag. This is the top of it. It will say top on the bag, and it has a drainage spout. It is applied to the thigh, and it has straps that are that you can wrap around the thigh. In order to apply the leg bag, you will need some equipment. You will have to have a sterile drainage cap and plug, and it will come in a sterile package. You will need to use a clamp to clamp the catheter to stop the urine from draining. And you will also need an alcohol wipe to wipe off the bag's top. I would like you to remember some points when applying the leg bag. It must be emptied more often because it is smaller than the drainage bag. Tension on the catheter tubing must be prevented. Care must be taken that the straps are not too tight around the leg. Leg bags are only used when patients are up. Remove them before returning to bed. Care must be taken not to introduce germs when opening the connections. Now I would like you to watch the demonstration of applying the leg bag.
Applying urinary drainage leg bag. Wash your hands and apply your gloves. Assemble needed equipment. Explain the procedure to the patient and provide for privacy. Raise the bed to a comfortable working height. Fold back the bed linens, maintaining privacy. Place bed protector under the connection between the catheter and the drainage tube. Clamp the catheter. Drain the catheter tubing of urine. Open the sterile catheter plug. Disconnect the catheter and the drainage tubing. Do not place them down or allow them to touch anything. Place the sterile plug into the catheter and the cap over the drainage bag tubing. Cleanse the drainage port at the top of the leg bag with your antiseptic wipe. Make sure the drainage port at the bottom is closed. Remove the covering and insert the end of the leg bag tubing into the catheter, making sure it does not touch anything. Release the catheter clamp. Remove the catheter leg strap and secure the leg bag with straps to the leg. Be certain that it is not too tight around the leg and that there is no tension on the tubing. Check for any leakage. Remove the bed protector and discard. Dispose of your used supplies. Empty the urinary drainage bag in the bathroom and you record your output. Clean and store according to facility policy. Remove your gloves and wash your hands. Reverse these steps to reconnect.
Most patients who have a urinary catheter inserted in them will develop a bacterial infection in their urine 10 to 20 days after insertion of the catheter. This bacteria introduced into the urine will cause what they call a urinary tract infection, sometimes abbreviated as UTI. This is caused by contamination of the catheter equipment during cares, or actually at insertion time of the catheter, sometimes bacteria is introduced. Signs and symptoms of a urinary tract infection are dark, cloudy urine, strong, foul smell to the urine, sediments or particles noted in the urine, and when the patient reports burning, an urgency, or abdominal pain. Prevention of a urinary tract infection, we would remove the catheter as soon as possible, provide a bladder retraining program, encourage fluid intake of 2,000 to 3,000 cc's per day unless it's contraindicated. Acidify the urine with beverages and foods such as cranberry juice, whole grain cereals, eggs, and meat, as these retard bacterial growth. We would maintain a sterile closed system and use a septic technique with daily catheter care. We would maintain patency, which is a free flow of urine from the catheter to the drainage bag. As you care for patients with a urinary catheter, please remember it is your responsibility to provide a safe and comfortable environment. Remember, your patients will benefit if you use the proper technique and principles that have been demonstrated in this video. Thank you.